Difficult points during colonoscopic examination. There are 5 difficult points during colonoscopy introduction. The first point is rectosigmoid junction. The second point, sigmoid descending junction. The third point, splenic flexure. The fourth point, hepatic flexure. The fifth point, ileocecal valve. Rectosigmoid junction is a very important area. If you pass it easily, the colonoscopic looping is minimized. The lumen opens to the left axis. Rectosigmoid junction has an acute bend. If you push, you will facilitate looping. To pass it easy, you can pass it through left torque and gentle push. The second difficult point is sigmoid colon sigmoid descending junction. This is a very mobile part because the sigmoid colon is intraperitoneal and the looping is unavoidable. To avoid looping, use right and left torque with continuous right torque. Use half suction to shorten sigmoid colon and use abdominal pressure on left lower abdomen. The third difficult anatomic point is splenic flexure. To pass splenic flexure easy, you should shorten the colonoscope to 15 centimeters at anal verge, deflate the colon, clockwise torque, slow and gentle push. If you cannot pass, you can change the patient position or pull back and restart. The fourth anatomic point is hepatic flexure. To pass hepatic flexure easily, you should deflate and withdraw. This is the law to pass the hepatic flexure and to drop into the cecum. First, angulate the tip to 180 degrees, right torque with suction and slow withdrawal to allow the tip to drop to the cecum. If you cannot pass, you can change the position of the patient to the supine position and use supra-umbilical elevation to elevate transverse colon. When you reach the cecum, the challenge is to have cannulate ileocecal valve by colonoscopy, either by use direct insertion when the two lips of the ileocecal valve are seen, as shown in the first image, or blind insertion by two techniques. One is bow and arrow trick. Bow and arrow trick angulate the direction of the tip of the colonoscopy towards the direction of arrow as seen in the image number 1, or deflecting the tip while approaching ileocecal valve as image number 2. Lastly, there are 5 main actions during colonoscopic examination. The first one is deflation by air suction and minimal air insufflation to shorten the colon. The second one is withdrawal to minimize looping and to straighten the colon. The third one is using torquing movement instead of use right and left wheel to minimize looping. The fourth one, which is very important, is sigmoid elevation to minimize alpha loop and to straighten the colonoscopy. The fifth one is to change the patient position